So good evening, everyone. Let me start the Q&A session. So first, I'll take these questions which are already there in the chat box. In the form which you have filled, and then I'll take the live questions. So first question is from Archie. Low milk supply and milk is not very much healthy. Low milk supply, okay, I'll answer. But what do you mean by milk is not very much healthy? So Archie, if you are present here live, just please let me know what do you mean by milk is not very much healthy. Next is Sarita, low milk. Poonam says low milk and latching issue. So sometimes low milk. So now tell me in the chat box, how many of you feel that you sometimes feel low milk, otherwise it is fine? Just write me in the chat box. If usually your milk supply is good, but suddenly you feel that sometimes my milk supply is less. So Priyanka Kaila says that sometimes my milk supply feels less. Nashra says that usually my milk supply is fine, but sometimes I feel that my milk supply goes low. Now, low milk supply, only 1 or 2 drops. See, 1 or 2 drops is a low milk. I am saying the mothers who have good milk supply, but suddenly some days they feel that, oh, today my milk supply seems very low. So for Priyanka and Nashra specifically, because you have mentioned that. So if you have not mentioned, suppose, so I'm just replying on this. So if your milk supply is otherwise fine, and sometimes you feel that the milk supply is less, then that doesn't happen naturally. It might be because of some factors, like if you have like your milk, your the sleep was disturbed, either you are too stressed out, or you are like your feeding etc is not very well. So if suppose you're not feeling like eating something, or your water intake is less, your sleep is less, you are stressed out, all these factors sometimes will like accumulate in a way that you might feel that the supply is low on particular days. How you can check about it? By seeing your baby's weight gain. If you're not giving formula milk to your child and your baby is gaining weight properly, that means you're not facing any low milk supply. That's perfectly fine. If you're not giving any formula milk and your baby's weight gain is good, so then don't worry about it. How you can improve if some days your milk supply feels low, and also if your periods have started, suppose yesterday or day before yesterday, for 2-3 days you might feel the milk supply is little lower side, but that's normal. After 3-4 days, it will be back on track normal again. So don't worry about it. So these are the basic, and how you can improve it. You can take little warm water bath. You sleep properly for 1 or 2 hours properly without any disturbance. You need to have somebody at your place who can help you out by with the handling of the child. And also you can get a massage done for yourself. That way it will help to relax you and your milk supply will be all back in track. So this is all about if you are feeling supply sometimes less, usually it is fine. Now moving to the next question. Meenal says regarding breast pump and its benefits or losses. Okay, it's a good question today, new question. So let's talk about breast pump. So breast pump is different for different purposes. So first, let's talk about a mother who is already breastfeeding her baby. And if I ask, should they use breast pump or not? So if a breastfeeding mother is also giving formula milk to her child, in that case, after breastfeeding session, she has to pump for 5 to 10 minutes. Now, this 5 to 10 minutes of pumping after the direct feeding is not to collect the milk. It is to give stimulus to the brain to increase more milk, to make more milk. Okay, this is the first condition. Now, second condition is a mother is producing breast milk, but the baby is not ready to latch. In that case, the breast pump is used to collect the breast milk. Clear? Third, the mother doesn't have any breast milk. Her milk has gone low and her baby is obviously not latching and the baby is totally dependent on formula milk. In that case, the pump is obviously required to create that demand to get the milk supply back on track. Okay. So these are the use cases where we use breast pump. So breast pump first of all, it is not a correct indicator of telling you how much milk you are producing. Many times I listen from mothers, they are usually breastfeeding and sometimes to check how much milk they are producing, they will pump. Now, when they pump and they get 20-30 ml, that really worries them. Oh, I am producing only 30 ml. So please, all the breastfeeding mothers, don't check yourself by pumping. If you check yourself with the pump, it will not give you a correct indicator of how much milk you are producing. For a breastfeeding mother, pump is a different stimulus. It will not empty your breast. So your pump output is not the correct indicator of how much milk you are producing. Okay, this is for all the mothers who are breastfeeding their babies. Now, what are the pros and cons? So basically, breast pumps are basically three types. One is manual pump. Second is electric breast pump. Third is wearable electric breast pump. So if your baby is on exclusive pumping, then preferable is to go for wearable breast pump. If your baby is 3 months and above and you are advised to do pumping, then also wearable breast pump. If your baby is less than 2 months and you are trying for direct latching also, there manual or electric, you can go for any, because there are still good chances that you can get your baby back to the breast. Okay, so these are all the pros. And talking about cons, so basically when you start doubting your milk supply with the pump, that is not correct for you. Also, for relactation mothers, when they start working, they will not get milk with the pump, but they will get milk with hand expression. So at that time, just don't worry about how much milk you are producing with the pump. The last and the foremost thing I would like to tell all of you, please don't worry about the quantity of breast milk you are producing. See, we are all human beings. We are not machines. We will not produce the same kind of milk every day. So if you keep focusing about the quantity of breast milk, that will only stress you out. So the composition of breast milk also keeps changing. And that's why when the mothers consult us, we ask them to take the baby's weight. So when you check the baby's weight regularly and you also track your baby's formula intake, that way you come to know how much milk, the quantity or the composition of breast milk is required for the child. If we keep tracking, if we keep reducing the formula milk, the baby's weight keeps increasing. That gives confidence to the mother that her breast milk supply is improving. And when I talk about breast milk supply, it doesn't mean only the quantity. It also means the composition of breast milk. So all these things are very important, and these are very much discussed when we talk to mothers one-on-one. Just give me 1 minute. Let me just mute you all.
Hello?
Yeah. So now moving to the next question. Now, I also want to keep talking to you. Just let me know the information which I gave you just now about the pumps. Was it useful? Just let me know by yes or no. Did you learn something new? Was it useful for you? The things which I told you, was it like gave you some insights about it? You need to keep talking to me so that I understand you all are listening to me, because I am not able to see any of you with the camera, all of the black screens, and I'm talking in black all without knowing. So I need to know that you all are listening. Thank you, Banu, so that you opened your camera, so that at least I'm talking one-on-one, human to human. It's not like human to screen. It's good, Banu, that thank you for that you opened your camera. And all the other mothers, if you can participate by like looking each other, it's good. Actually, talking to each other is good by when you see each other. That's great. So now moving forward on the next question is mostly our low milk, latching issue, low milk. I'll cover this, but in a few time. Refusing breast milk, this is the latching issue. Low milk, latching issue, sore checked. Sore and cracked nipples, baby having bottle habit from initial days, inverted nipple. So let's talk about this. Sore nipples, inverted nipples, baby used to bottles. Now, suppose you delivered in a hospital and a sister came and told that you have a flat nipple. Now, that thing will go in your mind. Oh, I have flat nipples. Then you start searching on internet, flat nipple, and everywhere you will get to know that you can't breastfeed your baby with flat nipples. So it will be deep seated in your mind that I can't breastfeed my child. So first of all, whatever anybody tells you, Don't worry about it. Nature can never do wrong in not giving you proper things to breastfeed your child. You don't have to feed from the nipples. Thank you, Sakshi, for opening your camera so that we can look at each other. That's great, Bindu. Awesome. Good girls. You all are my good girls. So the thing which I was talking about is anybody telling you that you don't have proper nipples, you don't have enough milk, please don't listen to them. Because after delivery, you are already vulnerable. You are stressed out because of the new habits, because you have to get up in the night, you have recently delivered your baby. All those stress is already there. And somebody starts saying you, hey, you have flat nipples, you have inverted nipples, you don't have enough milk. So please, first of all, make yourself very strong. Nature can never do wrong. Why? See, babies, you don't have to feed with the nipple. With the bottle, do you feed from the front end only? The baby holds the full nipple in the mouth. It doesn't drink from the front. Okay, so baby has to drink from the back side. Same thing with the mother. The baby has to feed from the areola, not from the nipple. The work of nipple is only to just drop the milk in the baby's mouth. So if you have inverted nipple, if you have flat nipple, if you have small nipple, please don't worry. It's the proper techniques. And when we talk about proper techniques, you have to hold the breast from below. Like suppose you are feeding from the left breast, you have to hold the breast in U shape from below. And when you press the breast, hi Padmani. So when you hold the breast and press the breast, then the pout will come out of the areola. And you have to bring the baby in a way that the baby holds this pout. Okay. And sometimes what I have seen, the physiology of breast, sometimes the breast is very firm and very tight. In that case, you have to do oil massage and warm compress to make it soft so that the baby can latch on the areola. And there are very good techniques of cross-cradle hold where the full technique is there, how to hold the breast to feed your baby and how to hold your baby. That way, if you have an inverted nipple, flat nipple, or a small nipple, please don't worry. It doesn't matter. You just need to feed the baby with the areola. Now, one question may arise from here. Ma'am, my areola is very big. My baby's mouth is very small. How to give full areola in the baby's mouth? So in that case, I have a very good answer for you. You don't have to feed full areola in the baby's mouth. Only the lower part of the areola. So it is called as asymmetrical latch, where the baby's head has to be extended so that your nipple points towards the upper palate and the baby has to hold only the lower part of areola. Upper part of the areola will be all visible to you. So that way you can latch your baby with a proper latch without giving full areola in the baby's mouth, only the lower part of areola. Okay, so today I'll demonstrate also the latching technique and we'll talk about the low milk supply also. Let me see, any other new questions are there? First, on the questions which you have filled. Shallow latching, got it. Low milk, low weight, closed pores. Now, this is also one more question which mothers keep asking. Ma'am, my pores are not open of the nipple. How to open the pores? So always remember, you would have seen that during pregnancy, there is a black colored layer which forms on the breast. That is very dark black. And as after delivery, it starts shedding out. Sometimes at chips, you can see clear black color skin comes out. So basically what happens, sometimes mothers are told that your pores are blocked. It doesn't happen that way. You have to latch your baby within half an hour after delivery. This actually should be taught when you are pregnant. Hi Sumi. So basically what happens if you have already delivered your baby and now you have become a mother, and though that initial half an hour is already gone. Hi Pranjal. So all that initial half an hour is gone for you. So first lesson you learn from here, if you know any pregnant mother, tell her that she has to breastfeed her baby within half an hour after delivery. Even she has got a cesarean operation also. The doctors and the nurses, it is their duty to latch the baby inside the operation theater itself. You can just talk to them during your pregnancy. Now, For you mothers, you're already become mothers. So for you, what you have to do, if you feel that your pores are not open, then when your baby latches on the breast, because of the pressure, the pores open properly. Still, if you feel that my baby doesn't latch properly or my pores are not open, then always remember this is not a pore issue. This is basically a flow issue, because you can't see your breast pores like this. Either stand on the front of the mirror and see how many pores are open, but usually the milk trickles out from small pores. You can't see all the pores are open. So for that, what you can do, if you are really worried about it, you can take little warm water and put little salt on that, and with that lukewarm saline water, you can just wipe off your breast with that. But don't worry, pores get open naturally also. You don't need to like wipe it off to clean it. Okay, this is just for your satisfaction. When you keep telling my pores are not open, my pores are not open, in that way you can do that. But usually they get open when the baby starts latching. And if you are pumping also, the pressure of the pump and the pressure of the baby's latch will open all the pores. Okay, was this okay for you all? Did you get something inside you that you got some information about the pores, about the inverted nipples? Just talk to me. Just write in the chat box that you are getting something important. You are learning something which is important for you all. Write in. I need to talk, all of you. Please don't sleep here. You're not here to sleep. Yeah, Sakshi, thank you. But I'm not seeing a very engaging audience here. People are really worried. I don't know where you all are. Not replying to me on. Just don't write questions, Naina. I'll be answering your questions. Right now, I'm just talking so that, because, this online thing, sometimes I just don't know whether you all are getting some insights or not. So I want the audience to be little talking to me so that I understand that you all are getting the points which I'm telling. Good. Thank you, everyone. Thank you, Rashmi, Priyanka, Pranjal, Bhanupriya, and Priya. Good. So let me move to the next question. Now, mostly are low milk. Everybody has written latching issues, low milk, incorrect latching. One is this Anis Parveen. Hi, ma'am. I am Anis. My kid is 4 months old baby. I'm not feeding for past 2 months. Some medical issues. Again, start to feeding. My baby is not cooperating. Please help. So don't worry. The baby is 4 months old. You have to start slowly. It's okay. Low milk, nipple pain. Difficult in facing issues. Okay. So now all of the questions are related to low milk and latching issues. Now, how many of you face painful breastfeeding? Just let me know how many of you face painful breastfeeding when your baby latches. You feel a lot of pain. How many? Are there any mothers here who are facing issues of painful breastfeeding? Okay. So I don't see painful breastfeeding mothers here. Very painful during and after feeding. Okay, Nupur says. So let's understand why it is painful. Now, all of you do one thing. Touch your tongue on the upper side of the palate. Touch. At the back side, you will see a cave kind of a thing, a dome kind of a thing. Okay, what is that? The mother's nipple should be going that side. That is called a soft palate. Okay. Now, behind the teeth, you will see that is the hard part of the palate. Just behind the teeth. That part has to be on the areola. Hi, Devasmita. So that part has to be on the areola. So imagine if the latch is shallow and this hard part is on the nipple, and usually the babies feed for 15, 20, 30 minutes, 6 to 8 times in 24 hours. So this is skin. If the baby will latch on the nipple with such hard part, it is going to be painful for you. So if you have to get rid of this painful latching issue, you have to work on your latch and have a deep latch. And how to get a deep latch is when you are putting the baby on the breast, you have to make sure that the baby is opening a big mouth and the baby's head is little extended. The baby should not come on the breast from front. The baby should come on the breast like this. So your nipple will be pointed towards upper side. So that way, if you are latching, the baby will be able to have a big bite and also in a way that the nipple will be pointing towards the upper side. Now you might say, my baby doesn't open a big mouth. The baby latches just small like this. Then how to make your baby's mouth wide open? So what you will do, when you're holding the breast in U shape from below, now you have to bring your baby from the opposite hand. So you will put lot of pillows, have a good height. Let your baby lie down like this. Your baby should not be lying like this. The baby should be turned towards you like this. Now you will be holding the baby's head from your opposite hand and holding the breast like this in from the side where you are feeding the baby. Now with this wrist movement, you have to make your baby's head little back. So extend this wrist. So this you have to do, imagine this way. Okay. So when you take your hand back, the baby's head will be extended and the baby's lower lip will be touching the breast first. So when you latch the baby, where the baby's chin is touching the breast first. Now with this finger, this thumb, you press the breast towards the upper lip. So upper lip of the baby, if you touch the nipple on the upper lip of the baby will open the mouth like this. If you see a small mouth opening, don't latch the baby inside. What you will do, you will tease the baby. Do 1 or 2 times like this. So baby will open a like this he will do or she will do. She will open a big mouth and like this they will do. And when they do that, you take the baby inside. Okay. Now in this process, your hand will again be straight. So once the baby latches, don't remove this hand. If you remove this hand, because of the weight of the breast, the baby will come on the nipple again. So you have to keep holding the breast from this hand. You can keep a small stool besides you where you can just rest your hand on that. And once the baby latches, just make sure you will see and you can make out, is the baby's, your nipple is pointing towards the middle of the mouth or towards the upper palate. So you have to make sure that your nipple is pointing towards the upper palate of the baby. So this way you will be able to have a comfortable breastfeeding and a comfortable latch. Okay. So that was about the latch. Now let me start taking questions because I see a lot of questions in the question box. So first of all, this iPhone, I know it is Anjali. So her question is, my baby is 5 months old. I am pumping thrice in a day about 150 ml. Else he is on formula milk. I wanted to know if exclusive pumping reduces the milk supply. I am going to take your appointment next month for exclusive breastfeeding. Please answer my query if exclusive pumping reduces milk supply. So first of all, Anjali, no. Exclusive pumping doesn't decrease your milk supply. Now you see one thing. Your baby is 5 months old and I'm very sure the baby would be taking at least 6 to 7 feeds per day. So if the baby is taking 5, 6, 7 feeds per day and you are pumping only thrice in a day, the demand for your milk to your body is less than what is the baby's demand. So if you're talking about the pumping, the exclusive pumping will not decrease your milk supply. So if your baby is 5 months old and not latching on the breast, then we can work on exclusive pumping and we can get you on exclusive breast milk also. And I have a lot of success stories where the babies who were not latching, the babies who were on formula milk have got on exclusive breast milk, and some lucky mothers are able to also get them on exclusive breastfeeding. Although I will not use the word lucky because it doesn't matter about feeding on the breast or not. Sorry for that. I will not use the word lucky there. It only means you can latch the baby if you want. If you want, because if you're a working mother, you have to join your office, then obviously you have to work on the pump. So you can even increase your milk supply with the pump, and you can get your baby on exclusive breast milk with exclusive pumping also. So I hope that answers your question, Anjali. If you have further question, just write in the chat box. Padmini, my baby is 1 month old. Milk supply is very low. I'll come on that question because this question keeps coming every time. Low milk, low milk. I'll answer that question. But let me see if there are any new questions. Asya says she has taken only one call. Please take your second call very soon. So that will help you there. Lucky says, I have a latching issue, ma'am. So latching issue, what is your specific latching issue, Lucky? I have given right now the demonstration for cross cradle hold. If you have any specific further questions about latch, please write in the chat box. Jigme says, baby 2 months, 13 days old, delivered through C-section, low milk supply, baby on formula and breastfeed, pumping in 24 hours, I get around 200 ml in total. So Jigme, now what will happen if your baby is 2.5 months old and low milk supply you are facing, your baby is both on formula and breastfeeding. So now what we will do, what we can do here, if you're pumping, if you're also pumping, first of all, you need to let me know, are you pumping separately or are you pumping after breastfeeding? Because if you are pumping separately and you are also breastfeeding your baby, also giving formula milk to your child, I am very sure 24 hours you are doing only this much. Only working around breastfeeding, which is not required. You need to enjoy your motherhood journey also. If you keep doing this breastfeeding part 24 hours, how are you going to enjoy your baby? So first, Jigme, let me know, are you pumping separately or you are pumping after your breastfeeding? Bhanupriya says, my baby is 2 months old and I have very low milk supply. I need to feed her 20 ml top up after every feed. Please help to solve this problem. Okay, so Bhanupriya, what you have to do after your baby has completed your breast milk and whenever you are giving top feed to her, 40 ml. After that, once the baby is settled, please pump on your breast. Okay, now don't expect any milk in this. Okay, Bhanupriya is here. Don't expect any milk in the initial few days because when you are pumping after your breastfeeding, imagine you have made, you know that there are 4 people in your family and you make 6 chapatis for them. Now suddenly one of them becomes more hungry. Now they are asking one more chapati, but they are not telling you. So you will not understand that they want one more chapati. 3-4 days after they say, Bhanupriya, I am hungry, I need one more chapati. Okay. So one day you will make chapati. Next day you are not sure that are they hungry today also. Okay. So they need to tell you regularly that Bhanu, please make one more chapati every day. So that's why when we start pumping after direct breastfeedings, we need to do it consistently for few days. Once we keep doing it consistently, the kitchen in our brain starts understanding that this demand is coming every day. So it will start making more milk. But here, you will not get milk in the pump because the baby will finish it because the baby is already breastfeeding. So the pumping will improve the milk if you are pumping after breastfeeding, but don't expect the milk even after it has improved because ultimately we don't want milk in the pump. Why do we want milk in the pump? We want the baby to finish all the milk. So how you will know whether my pumping is working or not? So that you have to check the formula milk, how much you are giving. Is it decreasing every day? If it is decreasing, is your baby's weight increasing every day? So if your formula milk is coming down and baby's weight is increasing, that means whatever efforts you're doing in this is working for you. Okay. So this way you will know whether should I pump or not. And once you are not giving any formula milk to your child and your baby is gaining weight properly, then you can start stopping pumping one by one. So that way you will be able to get your baby on exclusive breastfeeding without depending on formula milk. Clear? Good. So what happens with the same case is yours. When you people come to us, first I assess how much formula you are giving, how many times you are giving, what is the weight gain of the child, what is the age of the child, was it happening since beginning, or have you recently started giving formula milk? First, we take all these informations. Accordingly, we tell you when you need to pump, in which breastfeeding sessions you need to pump, and in which sessions you can leave. So all that becomes a customized things for you after knowing what is your problem in that. Okay. So right now I can give you a general idea that you can start pumping, and this way you can know whether it is working for you or not. So next, let's move to next question from Rashmi. Low milk, only 1 or 2 drops. My baby is 18 days old. Rashmi, if your baby is only 18 days old, what made you come here at low milk at 1 or 2 drops? See, nature will never do wrong to not give you milk properly. Hi, Sarita. Good to see your faces. So, if nature will never do wrong that it will not give you enough milk. So if the milk supply has dropped to 1 or 2 drops in just 18 days, what has been missing, Rashmi? Please give me a detailed history what happened from day 1 so that I understand why did the milk supply drop to 1 or 2 drops in just 18 days. Because nature will never do wrong that it will not produce enough milk once the baby is born. Something has been disturbed in between that it has gone so low. So please write in the chat box what is the proper history of your child. Next is from Priya. Ma'am, my baby isn't taking the breast nipple in her mouth. She doesn't open her mouth. Please let me know what is the age of the child. What is the milk supply? See, if you ask me generally, why is she not taking breast milk nipple in the mouth? Why she is not opening? I will not understand until I know some history. What is the age? How many times is she taking formula? Is she taking with a bottle or with Vati spoon or with Palada? You have to give me a little history so that I understand what is the main case. Hi, Bharani, Monica. Good to see all of your faces today. Rashmi says, baby don't latch because of this. You need to tell me, Rashmi, first, because 18 days baby's milk supply dropped to 1 or 2 drops. What happened exactly? Next is Sakshi. Low milk supply, baby is on formula as well. Baby is not latching also. So, see, understand, when we say low milk supply, baby is on formula and baby is not latching. We ourselves are giving one answer to the question that our baby is not latching because we are having low milk supply. Baby has got no personal grudges with you. He's your child. Okay, or she is your child. So, the only problem is the baby is hungry. The baby needs milk. The baby needs food. And if the bottle was introduced to the baby from day 1 or day 2 or day 3, whatever time has passed, the baby understands that this is the source of milk for me. So as the baby keeps growing, they keep understanding that this bottle is my source. This is the milk. When you take them on the breast, they feel, hey, mom, you are doing something wrong. This is not the place where I should be. I should be on the bottle. Okay. So now if we want to get them on breast, then what we need to do first of all, stop pushing them towards the breast. Many times mothers tell me when they just open the chest and the baby starts crying. What is this? This is breast aversion. When you start pushing your baby on the breast, when the baby is hungry, baby is crying, and you are putting them on the breast again and again, they will become more cranky. They will become more agitated. And they will start crying on even taking them on the lap sometimes. So here, first of all, give a break to them. Just keep them skin to skin. Don't push them towards the breast. Keep them skin to skin. Hold them, cuddle them. Win your trust back. And then when they are lying down, when they are playing in the night, when they are sleepy, that time take them to the chest. And also when you're giving bottles, if you have introduced bottles and the baby is not ready to leave the bottle, in that case, hold the baby close to you as you are feeding from the breast, and then you give the bottle. Many times I see babies are lying properly in the way, very far from the mother, and the baby is getting feed from the bottle. Or anybody in the family is feeding the baby. In that way, the baby is not used to you. Why will the baby latch? And especially when you are already having low milk supply. The baby is hungry. The baby needs milk. And if you already have low milk supply, the baby will not cooperate on you. So this is a slow transition where you need to work on your supply, on your latching issues, and slowly you have to bring that trust back so that baby can come on the breast. I hope that answers. Asya says, my baby is not sleeping when he's taking my nipple. So always understand, Asya, if the baby is feeding but the baby is not sleeping, that means the baby is not emptying the breast. Now, how you will know that the baby is emptied the breast or not? After every breastfeeding session, just press the breast and see the color of the milk. Always remember the breast milk is in two parts, fore milk and the hind milk. First milk which comes in, that is fore milk, which is watery in color. Then the hind milk comes, which is little thicker white. So the baby first finishes the fore milk, then finishes the hind milk. Hind milk is rich in fat. It keeps the baby satiated for longer time. It also helps in gaining the weight gain of the child. The fore milk is rich in antibodies and is also good for hydration of the baby. Now, if your baby is not sleeping with breastfeeding, that means your baby is predominantly drinking only the fore milk. So in that case, after breastfeeding, if you check the color, you will mostly see that the thick white milk is coming out. And that is a very clear indication that your baby has not properly emptied the breast. In that case, just hand express, or if you see a lot of milk coming there, you can pump also. And after the feeding, you can take if the baby is very cranky, take the baby on the other breast, knowing that your milk is still there on the left breast. The baby has not emptied the milk. So after you have expressed the milk, you can give this expressed milk to the baby slowly, and keep working on your latch for a deep latch, which we just discussed. So once your baby starts latching in a deep way, the baby will be able to empty the breast properly and will start sleeping also with breastfeeding. Okay. Next is Meenal says, what is the good way to check the milk supply? Good question. So what we have to do, we can't check the composition of breast milk. Then how to check whether our milk supply is good or not? So first, if you are not giving any formula milk to your child. Second, if your baby is gaining weight gain. Now all of you please write what is the weight gain parameters. If your baby is less than 3 months, the baby should gain around 150 to 200 grams per week. If your baby is between 3 to 4.5 months, your baby should gain around 100 to 150 grams per week. If your baby is between 4.5 months to 6 months, your baby should gain around 100 grams per week. If your baby is more than 6 months and also taking solids, at least the baby should gain 50 grams per week. And on a wider parameter, what we can say, the baby should triple the birth weight by 1 year. So these are the weight gain parameters. Now, if you have to check your milk supply, then if you are tracking your baby's weight weekly, Sunday to Sunday, just check your baby's weight. And how you can check at your home? On any weighing machine, first stand alone, then hold your baby and stand on the machine and minus the weights. So you will understand how to check the weight. So this way, check the baby's weight. If you are not dependent on formula milk and your baby is gaining weight in these parameters, then your milk supply is all good. You don't need to worry anything about milk supply. This Asya says, my baby is sleeping when he is taking my nipple on his mouth. This is a very clear indication that the baby is having a very shallow latch. Or the supply is less or the flow is less. So Asya, you need to work on all these three things. Your flow, your supply and your latch. Devasmita says, my baby is 8 months and my milk supply totally stopped. Is it possible to get milk now? Yes. For 8 months, baby, I have a very good success story. If you go on my YouTube channel and go on the Mom Star series, you will find Nikita's video. So Nikita is a is a working mother. She's working in a hospital. She reached out to me when her baby was 8 months old because she was working in a hospital. So she was really worried about her baby's immunity because baby was on formula milk. Because she was working, we were not able to get the baby on the breast. So I suggested her the pumping protocols and we were able to get her baby on exclusive breast milk. So basically for 8 months baby, relactation is very much possible, Debasmita. You can watch that video to get that inspiration and the motivation that yes, I can also get my baby on breast, like breast milk for a 8 months baby. And I have very successful relactation story of a mother whose baby was 2 years plus. Mrs. Kiran from Panchkula. You can see that success story on my YouTube channel in Momstar series. So Momstar series is our channel in the playlist in our channel, which is all about the success stories of breastfeeding mothers. So when the breastfeeding mothers, they get their all issue resolved, we just ask them that will they come on our interview session. So mostly say no, but some of them are bold moms. They just come that, okay, I'll be here sharing the journey so that many mothers get inspired with that. So those stories are there on our YouTube channel. So you can watch them. That will really inspire you and motivate you that if these mothers can get their issues resolved, even we can get that. Now moving further, next is Sakshi. I am doing pumping in whole day. It's around 80 ml and my baby is on formula milk with bottle. Okay. She's taking 120 ml every time. She will be 4 months within 9 days. When will I teach her to, when will I reach to her hunger quantity? What do you mean by hunger quantity? बर्थ के बाद ये ब्रेस्ट फीड करती थी, बट ये उसके बाद रोती थी, तो बड़ों ने कहा पेट नहीं भरता है सफिशिएंट नहीं है तेरा, तो फॉर्मूला स्टार्ट कर दिया था स्टार्टिंग से ही. बट मैं डेली फीड करवाती थी, बट धीरे धीरे फीडिंग बिल्कुल फॉर्मूला पे डिपेंड हो गई. अब योर डॉक्टर्स रिकमेंड मी टू पंप एंड मसाज अलोंग विद द मेडिसिन, बट बेबी के रिक्वायरमेंट तक सप्लाई कब पहुंचेगी, क्योंकि टाइम के साथ बेबी की भूख बढ़ेगी एंड आई वांट कि वो पंप से निकला हुआ मिल्क नहीं, फॉर्मूला नहीं, बॉटल से नहीं, डायरेक्ट फीड करे और पेट भरे उसका. ओके साक्षी, नाउ आई हैव अ होल स्टोरी ऑफ योर्स. I know whole the history here. So let's first understand one thing, that if you are pumping, अगर आप पंप कर रहे हो और आप ये देखते हो कि मेरा मिल्क कम आ रहा है. आपको मैंने अभी जब ये हमने वेबिनार स्टार्ट किया था तो मैंने एक चीज बताई थी कि मिल्क की सिर्फ क्वांटिटी को नहीं देखना है, मिल्क का कॉम्पोजिशन भी देखना है. तो ये सारे मदर्स, अगर आप फॉर्मूला और ब्रेस्ट मिल्क दोनों दे रहे हो तो आप कैसे जानोगे कि आपके मिल्क सप्लाई में कुछ इंप्रूवमेंट हो रहा है कि नहीं. आपको करना क्या है, डे 1 और डे 7 का वेट लेना है, यानी आप हर हफ्ते बेबी का वेट लोगे. मैंने आपको जैसे भी पैरामीटर्स बताए हैं उसके हिसाब से अपने बेबी का वेट ट्रैक करोगे. डे 1 और डे 7 पे आपने कितना फॉर्मूला मिल्क दिया वो ट्रैक करोगे. आपको ये नहीं ट्रैक करना है कि मेरा मिल्क कितना आ रहा है पंप के बाद, वो एक डिफरेंट चीज है, क्योंकि क्वांटिटी और कॉम्पोजिशन को आप नहीं चेक कर सकते. आप क्या चीज चेक कर सकते हो कि बेबी का वेट गेन कितना हो रहा है, बेबी को फॉर्मूला मिल्क में कितना दे रही हूँ. तो अगर विथ टाइम आपके बेबी का फॉर्मूला मिल्क कम हो रहा है और बच्चे का वजन बढ़ रहा है, यानी आप जो भी कर रहे हो वो बच्चे के लिए सफिशिएंट है. इसलिए आप सिर्फ क्वांटिटी को मत देखो कि मैं अगर 120 ml फॉर्मूला मिल्क देती हूँ तो मुझे हर पंप में 120 ml मिल्क चाहिए. ऐसा नहीं होता है. अगर आपका फॉर्मूला मिल्क 120 ml चल रहा है तो आप अगर 40 ml या 50 ml या 60 ml भी पंप करके दे रहे हो, आपको ये फील होगा विद टाइम कि उससे भी बेबी का पेट भरने लगेगा. बट क्या चीज इंपॉर्टेंट है कि आप कंसिस्टेंटली ये चीजों को करो. आप लोग बीच बीच में छोड़ देते हो, बीच बीच में परेशान हो जाते हो, अरे हो तो रहा नहीं है कुछ, छोड़ देते हो, फिर कहीं कुछ पढ़ते हो, फिर एकदम एक्टिव हो जाते हो, फिर से पंप स्टार्ट कर देते हो. तो जब आप इस तरह से बीच बीच में ब्रेक दे दे के करते हो तो आपका ब्रेन कंफ्यूज हो जाता है. आपको कंसिस्टेंटली चीजें करनी है और एक बार में खत्म करो उसको करके, क्योंकि बार बार करते हो फिर छोड़ते हो, फिर करते हो फिर छोड़ते हो, उससे आपका बॉडी और ब्रेन कंफ्यूज हो जाता है. तो इसलिए आपको कंसिस्टेंटली, अगर आप पंप कर रहे हो अभी तो आपको करते जाना है. आपको जो डॉक्टर्स ने रिकमेंड किया है, पंपिंग, मसाज, मेडिसिन, जो भी चीजें दिया है, करेक्ट डोजेस में यूज करना. जो चीजें उन्होंने बताई हैं बिल्कुल वैसे का वैसे यूज करो. जिन डेट्स पे वो आपको वापस बुला रहे हैं उन डेट्स पे वापस जाओ, क्योंकि हम लोग के प्रोटोकॉल्स होते हैं, हम उनके हिसाब से आपकी मेडिसिन की डोजेस बदलते हैं. तो आप जब रेगुलरली आते हो तो हम भी आपको प्रॉपरली उन डोजेस के हिसाब से फाइनल तक ले जा पाते हैं. तो मिल्क की क्वांटिटी को देख के परेशान मत हो, बेबी का वेट गेन ट्रैक करो और बेबी का फॉर्मूला मिल्क कितना चल रहा है वो ट्रैक करो. ठीक है साक्षी. Devasmita, could a never latched 8-month baby can latch? So this is very rare, but I will not say no. One of my 10-month baby who has never latched in life started latching in the night. The baby didn't latch in the day, but started latching in the night. Because she was a working mother, so we were okay with that. The mother has to go to her office in the day. She's a 10-month baby. The baby is now latching in the night. Daytime, she feeds the solids and the express breast milk. So yes, a baby who has never latched can even latch at 8 months also, because one of my recent 10-month baby has latched. But I will say this is not a very regular case, because a baby who has never latched for 8 months, you need really lot of skin to skin and cuddling and lot of peace from here to work on that. Next. Sarah, my baby drinks milk for hour but don't get satisfied. Again, this is very common question. My baby keeps drinking for 45 minutes, 1 hour, the baby is still hungry. The baby doesn't keep drinking for 45 minutes and 1 hour. If the baby is taking that much time, that means the baby is sleeping in between. So if your baby is doing this, that feeding for 1 hour, what you have to observe? When we drink any liquid, we see the gulping movements in the neck. So what you have to do when you're feeding your baby, you have to see the gulping and the swallowing movements. If you're not seeing the gulping and the swallowing movements, the baby is sleeping on the breast. In that case, just remove the baby from the breast. If the baby starts crying, let them become little active and then only take the baby on the breast. If the baby has slept, it's okay. Then you can stop feeding at that time. So if you're feeding for 1 hour, the baby is sleeping on the breast, the baby is not feeding for 1 hour. Next is from Rashmi. Breast becomes saggy after pumping and stop producing milk after 2 days. So how does the breast become saggy? Basically, once you pump, either your pumping is not proper. If the breast is becoming saggy after pump, was it formed before the pump? When you started pumping, there was milk, and after the pump, the breast becomes saggy. That means the pump has taken out the milk. I am not understanding your question, Rashmi. Please write it again. My baby is 1 month, 11 days. Her weight is 3.8 from 3.2. Had a latching issue, totally depending upon pumping. My concern is how to increase milk supply through pumping. So 1 month, 11 days baby. First of all, Monica, tell me, why are you not trying for direct feeding? Because less than 2 months, we have very good chances that we can get the baby on the breast properly. I know you had a latching issue, but let me know. And 1 month, 11 days, so it is around 5 weeks, 5, 10, 1 kg, 3.8 from 3.2. Even the weight gain is little lesser side. So we need to work on the weight that at least we should get around 150 to 200 grams per week. Debasmita says, ma'am, I'm totally depressed. Let me know, why are you depressed, Debasmita? I'm here. I'm here to tell, guide all of you. What is the reason? Why are you depressed? Please write to me. Hada Thakur, ma'am, my baby is 2 months. She latches properly, but even after latching for half an hour, she cries for milk. She is not full, and that's the reason I have to give her formula. I just answered that question, that if your baby is crying even after feeding, first of all, you need to check the color of the milk and know whether the baby has emptied the breast or not. Second thing, you have to check if the baby is sleeping on the breast. So I just told you how to check. Those 2 things you have to check, Hada. Jigme says, same issue, my baby is 2 months, 13. So same answer for you also, Jigme. Sumi says, ma'am, I have low milk supply. Okay. So let us talk about low milk supply. Hi, Avantika. Good to see you. So let's talk about low milk supply, because I kept in the last, but let me take that question. So basically, see, always remember, when we talk about low milk supply, then first of all, we have to understand that we have to create enough demand for our brain, which is the kitchen for our baby, to make more milk. So suppose your baby is, we will take these 3 conditions. If your baby is already coming on the breast, but still not satisfied, and you have to give formula milk from above. In that case, after every breastfeeding, just pump. Don't expect any milk in the pump. The pump we are doing is to create that extra demand for the brain. The baby will empty the breast. How you will check the whether the baby has emptied the breast, or is the milk increasing or not? By seeing the weight gain and by seeing the formula intake. Now, the other thing, second part, if your baby is not at all latching on the breast and you are pumping, then you have to create the pumps in a way according to the feeds of the baby. Amount of feeds is equivalent to the demands which you have to create on your breast, that you can do with the pump. So these are the two conditions here where the baby is not latching, where the baby is latching, in these two conditions. Now, for low milk supply, this was the demand and supply. Other than that, what you have to do is number one, hydration. You have to take good water intake to improve your milk quantity. And obviously for quality will come there, other things for composition. This is about the quantity. So you have to work on having good hydration. Second is the flow part. And also mind everyone, if your bottles, just turn the bottles which you are using. If the milk is dropping by itself, then the baby will get very good flow with the bottle. These babies will not properly cooperate on your breast. So you have to make sure the bottle should not, the milk should not be dropping by itself. So either you can shift to the spoon feedings, or you can shift to the palada feedings, or you can shift to the nifty cup feedings. All these feeding patterns are also good alternate feeding methods to the bottles. Now, for improving the flow on your breast, you need to do regularly you have to regularly do oil massage and the warm compress, which will improve the flow of your breast milk. Third part, when we talk about the medicines. So there are some allopathic medicines which we recommend only for the mothers whose babies are taking formula milk more than 4 times a day. So there are some allopathic medicines, but their doses and those things are very different. So that needs to be personalized according to you. For regular, when we talk about regular natural galactogogues, the things which I usually recommend is Lactomagic powder and Morico tablets. Why do I recommend these two things? Because the other things like Galact, like Lactare and Lactonic, Lactavase, whichever you get in the market, most of them have got preservatives added into that. If you see the backside of it, it has got either sodium benzoate or it has got sodium methyl parabens. Parabens are not safe because we don't use them for even shampoos and creams. Paraben-free shampoos, paraben-free creams are coming. And if they are put in your this galactogogues, I don't recommend them taking them, because if you're already giving formula milk, a lot of preservatives are going to your child already. Now with these things also, the more preservative load will be there for the baby's tender kidneys and tender liver. So that's why we need to avoid as much as possible any kind of preservatives. So this is one thing here. So the two galactogogues which I recommend are Lactomagic and Morico. Third part when we talk about is lot of cuddling and skin to skin. You need to keep the baby skin to skin at least 3 to 4 times. And when you are burping the child, you can keep the baby skin to skin. And the last and the most important thing is tracking. You need to keep track of your baby's weight and how much formula milk you are giving. So this way, if you are facing low milk supply, try to work on all these things. And I always recommend the mothers, if you have been facing low milk supply, the tips which I give to you, you try for 1 week. If it works for you, very good. If it is not working for you, please don't wait for these things to work on their own. Reach out to us. We'll give you a customized plan for you as per your things, so that you get your results faster. That way it will be faster and you will always be able to track the results. So this is what I recommend for low milk supply. Next is Asya says, please repeat how to hold the breast. You can see the recording, Asya, don't worry. This recording will be available either tomorrow or day after tomorrow on YouTube channel. Lucky says, ma'am, how to convert baby formula milk to breastfeeding? So we have been talking about all these things, dear. We need to be patient first. We need to keep patience. We need to have baby skin to skin with you. If your baby is already 2 months old or 3 months old or 1 month, so you have to give that much time at least back into the process to get everything resolved. Nothing works like a magic that if you just have a magical wand around and the things will work on their own. You need to keep patience and keep moving. Now the relatives come, you move to some place. There are a lot of things happening at your place. So you have to make sure that you have to work consistently on the things to get your issues resolved at a faster rate. Next is Bhanupriya. Latching is good, but my baby cries after every feed. Okay, so I understand if you are feeling that the latching is good, you have to make sure the lower lip of the baby should be on the junction of areola and breast. If that is there, good. If the baby's chin is touching the breast of the mother, that is good. If you're seeing when the baby is gulping, the neck movements are very good. Deep sucks you can see. Fourth part is when the baby is feeding, you don't see any dimpling in the chin, in the cheeks. The baby should feel fuller when the baby is suckling. If you are seeing all these signs, it is a good latch. Then what is the thing only required is you need to pump after your breastfeeding. So slowly, it will give more demand and your milk supply will start increasing. And you need to keep a track of your baby's weight and the formula intake. You can take the help of the galactocox, which I suggested. Try for 1 week. If it is not working, get back to us. We'll plan it out for you. Next question is Monica. My main concern is how many times I need to pump and duration of pumping every time. So if you're first, I need to understand, are you only pumping or are you breastfeeding and pumping also? So if you are breastfeeding and pumping also, you need to pump after your breastfeeding sessions. If you are only pumping, then you have to pump as per your baby's demand sessions. Kamla Sri says breast engorgement issue. So if you are facing breast engorgement, you need to do oil massage and the warm compress. It will dilate your vessels and the milk supply will improve. Next is Priyanka Kaila. Ma'am, my baby is choking on milk every feed while I am feeding in sitting position. If I am feeding baby in lying position, baby is not choking. Please suggest me which position should I use so that my baby won't choke again. So as you said that in lying position, the baby is comfortable. You can continue feeding in that position, Priyanka. Sumi says how to increase milk flow. To increase the flow, you need to do oil massage and the warm compress. Padmani Dhara says, ma'am, my breast is very big and baby is very small. Difficult feeding issue. I'm not comfortable feeling better. Okay. So in that way, if your breasts are big and the baby is very small, the same thing. You have to hold the breast. Okay. You can support your hand with a stool or a pillow at the side. When you hold the breast and you hold the front part of the breast, then and when you bring the baby will be able to latch on the areola. That way it will be helpful. So I have seen mothers with heavy and a bigger breast. When you hold the breast and support the breast, the baby will be able to come on the breast. Don't worry about it. Monica, my baby is 1 month, 11 days. Wait. Already answered this. Jigme, maybe 2 months, 13 days, so C-section. Reading this, baby is 2 months, 13 days, delivered through C-section, low milk supply, baby on formula and breastfeed, pumping in 24 hours, I get 200 ml. Tried is using formula feed for baby to increase milk supply, but baby weight is not increasing. So after increasing the formula intake to 90 ml per feed, then his weight is increasing. Therefore, it is clear that my milk supply is low and not the issue of latching. Yes, correct, Jigme. So you need to work on your supply. Rashmi, my baby is 18 days old, breast size is big. This already we answered. Asiya says, मैम प्लीज हिंदी में बोलिए. ओके, तो आप अपना क्वेश्चन पूछिए, मैं हिंदी में. जो लोग मुझे इंग्लिश में क्वेश्चन बोलते हैं मैं इंग्लिश में आंसर करती हूँ. जो आप हिंदी में बोलते हो तो मैं हिंदी में आंसर करती हूँ. अब हिंदी में क्वेश्चन पूछोगे मैं हिंदी में आंसर करूंगी. तो आप जैसा पूछोगे मैं वैसा आंसर कर दूंगी. Sumi, hi ma'am, after 5 months milk will increase? Yes, why not? It will definitely increase. iPhone, how to increase milk on exclusive pumping? You have to pump as per your baby's demand. मीनल, मैम अगर लो मिल्क सप्लाई के कारण बेबी को पंप करके कुछ फीडिंग दे और बाकी फीडिंग डायरेक्ट फीडिंग थ्रू दे तो क्या बेबी को फीडिंग बॉटल की हैबिट लगने से रोका जा सकता है? बिल्कुल, आप खुद ही आंसर दिए हो इसका. तो अगर आपको ऐसा है तो आप थोड़ा मिल्क को पंप करके आप कटोरी चम्मच से दे सकते हो, आप निफ्टी कप से दे सकते हो, आप कप से फीडिंग करा सकते हो, आप पलाडा से फीडिंग करा सकते हो. बॉटल में एक्चुअली फ्लो का इशू होता है, बच्चे बॉटल बहुत जल्दी समझ जाते हैं. एक और प्रॉब्लम क्या होती है, जो यूजुअली बॉटल्स पर निपल्स आते हैं वो आगे की तरफ बड़े पतले से होते हैं. बच्चे उसके यूज टू हो जाते हैं, उसको फीडिंग करने लग जाते हैं ऐसे ऐसे करके. लेकिन जब माँ के ब्रेस्ट पे आता है तो उन्हें फीडिंग ऐसे करनी होती है. तो ये दोनों का फ्लो बहुत डिफरेंट है, बच्चे कंफ्यूज हो जाते हैं. इसलिए इस तरह से बच्चे बॉटल पीने के बाद माँ के ब्रेस्ट को अवॉइड करने लगते हैं. तो अगर आप बॉटल को चेंज करके आप निफ्टी कप या पलाडा या कप फीडिंग करा सकते हो तो इससे बहुत अच्छा हो जाएगा. Bhanupriya says, I don't pump. I just feed my baby in every 2 to 3 hours, but still I need to give her 30 ml to 50 ml top up. How can I stop giving her top up? So as I already said, Bhanu, just after the feeding sessions, you just pump for 5 to 10 minutes. Okay. You might not get milk in this, but this will give an extra demand for your brain to make more milk. And you track your baby's weight on day 1 and day 7. What is the age of your child? If your baby, I just gave the weight parameters. You need to check the baby's weight accordingly. If the weight is increasing, start reducing formula 10 ml and keep seeing the weight gain. If the weight gain happens and formula starts reducing, it is perfectly fine. with it. Ravina. Hello, ma'am. I can feel some lumps in the breast, upper right side and upper left side. What to do, ma'am? Could you please help? While hand expression, it's hurting also. So if you are having lumps in the breast, you need to do oil massage and the warm compress. And specific for lumps, the comb you can take and just like rub it for 1 or 2 minutes on the lumps. So the lumps will slowly, and that time you just feed your baby. So baby will be able to empty the breast. And if you are specifically having lumps in the axilla or this portion, then don't raise your hand and sleep. Don't do that. Keep your hands below and then sleep. Because of that, raising your hand also makes lumps in the axilla. My baby is extremely screaming while I try to breastfeed her. So you have to do oil massage, warm compress, and then breastfeed the baby. Kamla, hi ma'am, my baby is 11 days old on formula milk, not latching properly. My breast get engorged and I get fever. What to do now? If you are getting fever, please go to the gynecologist tomorrow itself. With engorgement and fever, this shows that you are having infection. Kamla, please go to your doctor tomorrow itself. Jigme, pumping after breastfeeding. So what is the question? Zafreen, my baby is 3 months old. I can't feed even a single drop of breast milk. Baby takes only formula milk. So I've given the tips on how to increase the milk supply. Try to work on one week for that. If it is not working, please don't wait for it. Just get back to us. Your baby is already 3 months old. We can't keep waiting and keep trying for the tips and tricks. You need a proper customized solution for that. And just get back to us. We'll make a proper customized plan for you. And that way it will help you to resolve your breastfeeding issues. Shalini, my baby is 2 months old. She needs breastfeeding. But for me, low milk supply, she starts crying. So I gave formula. She refused the formula. It's good that she is refusing, my good child. So if the formula milk they start refusing, then only you get worried. Hey, what should I do? What should I do? So that's a good thing. So you need to work on your supply. So today I've already given tips about how to increase the milk supply. Work on it for 1 week. If it works, keep going. And if it is not working, get back to us. Rashmi, my baby is 18 days old. Breast size is big. Baby do not latch because milk comes in drops only. After pumping for 2 days, breast milk supply stopped and breast became saggy. Not getting any milk now. Okay. So Rashmi, only pumping for 2 days, you can't take out any inference. And how many times you are pumping? Your baby is just 18 days old. You can really work on it and get your milk supply up, and obviously you can also latch your baby. So 18 days baby, I will not say to leave anything. Please, please, please work on it. You can definitely get your baby back on the breast, and also you can improve your milk supply. Just try to see if you can work on your own. If it is not working for you, don't waste time here. This is a very crucial time. Your baby, when becomes 6 months, you don't know also. So try for a few days, any tips and tricks. If it is not working, please don't wait for it to work on its own. Reach out to an expert, whomever you trust, and get your supply issues resolved. Asya says, my baby has a habit of bottle feeding. What to do for the breastfeeding? So as I said that if your baby is already developed bottle feeding, first change the bottle. If it is possible for you to remove the bottle, that will be very good. Nupur says the pain radiates from the nipple to shoulder and teeth even after hours of breastfeeding. Even if I try to bear the pain and feed baby for 1-2 hours in a single sitting, my baby is still hungry and baby's weight was not increasing. Hey Nupur, this is a very serious latching issues. If your pain is radiating from the nipple to the shoulder and the teeth, hey, it's a serious issue. Please don't feed your baby for so long and with such shallow latch. You need to discuss all these issues with a latch expert. So if we have a very good latch expert in our team, if your milk supply is very good and only latching issue, reach out to the team tomorrow and get your consultation done with our latch expert. She will be on video call on one-on-one and will teach you proper latching techniques with your baby. Jigme, ma'am, I want to go for exclusive breastfeeding. So to improve the supply, I go for pumping to improve the supply. I go for fewer power pumps, frequently pumpings, but nothing helps. For example, if I feed him formula around 11 a.m., instead of breast milk in 3 hours, later I try pumping, but still it's very low. I tried reducing formula, but his weight is not improving. Please help. So Jigme, here I will say, please don't wait here. Reach out to the team and get your consultation done as soon as possible because you have already tried. The baby is not improving the weight. You need to work on this properly. Naina, how to shift exclusive breastfeeding? I already gave all these answers today. How to get your baby on exclusive. You can watch the recording if it was not clear, because I have to make it fast to answer all these. Still, I can see 51 questions still pending. So I need to move fast. You can watch the recording if I'm too fast for you to listen to that. Bhanupriya says, do I need to take any medication? First, see for 1 week. See the weight gain. If the weight gain is proper, you don't need any medication. If the weight gain is not happening, then obviously we need to give some medications. अवंतिका, मिल्क नहीं बन रहा है मैम, मेरा मिल्क प्रोडक्शन कम हो रहा है। तो अभी हमने डिस्कस किया अवंतिका कि मिल्क सप्लाई को कैसे बढ़ाएं। आप एक बार इसका वीडियो दोबारा कल देख लीजिएगा, कल या परसों में आपको यूट्यूब पे आ जाएगा ये रिकॉर्डिंग आज जिस सेशन की है, उसमें मैंने बताया है पूरा कि लो मिल्क सप्लाई के लिए कैसे क्या करना है। आप उसको देख करके प्रॉपर वर्क करिए। मैं हर मदर को यही बोलती हूँ कि जो मैं आपको टिप्स एंड ट्रिक्स बताती हूँ वो मैं जनरल चीजें बताती हूँ, तो अगर आप उसको देख करके 1 हफ्ता फॉलो करिए, अगर उससे आपको रिजल्ट्स मिलने लग जाते हैं तो आगे बढ़ते रहिए। लेकिन अगर आपको उससे रिजल्ट्स खुद नहीं मिल रहे हैं, इसका मतलब आपको स्पेशलाइज कस्टमाइज अपने लिए कुछ करवाना है, तो उसके लिए डॉक्टर से अपनी कंसल्टेशन लगवाइए। हम लोग के पास एक्सपर्ट्स हैं जो ऑनलाइन कंसल्टेशन लेते हैं, आप उनसे लेकर के अपने लिए कस्टमाइज सोल्यूशन लेकर के अपने इशू को रिजॉल्व करिए। पहले 1 हफ्ता ट्राई करिए, अगर जो मैं चीजें बताई उस रिजल्ट्स आपको आते हैं तो करते रहिए। Sumi, how to convert exclusive breastfeeding after 5 months old baby? So for after 5 months old baby, first we need to work on improving the supply. Once the baby starts the supply starts improving, then we can work on the latch also, because a 5-month-old baby starts forgetting how to feed. So we have to teach the baby also, and we have to improve on the supply also. Bharti Yadav, my baby is 5 months old and I am bottle feeding. I want to lift to my breastfeeding. So same thing, Bharti. See, 5 months babies, if your babies are on exclusive formula, then first we have to work on the supply, on obviously on either the milk quantity or the composition. Then we can try to get them on the breast. If the baby is already 5 months never breastfed, how can we get them on the breast when the milk supply is very low? Next is Priya Dingra. She's 20 days old and taking the formula milk with the bottle. So if the baby is 20 days old, you can remove the bottle, because the baby would be taking 30 to 60 ml that you can give with the palada also easily. Shalini, hi ma'am, my baby is 2 months old. She needs breastfeeding, but for me, low milk supply. She starts crying, so I give her formula milk and she refuses the formula milk. Already answered Shalini. Rashmi, baby did not latch. Baby got jaundice after 6 days. Was admitted in the hospital for 2 days. After breast pumping, milk supply stopped and breast becomes saggy. It's okay, Rashmi. I have already answered about this, that what you need to do. Just work on that. Shreya, hello ma'am, my baby is 1.5 months and I have low milk supply. So for low milk supply, I have already answered in details. If it was not clear to you, you can watch the recording. How to increase milk on exclusive pumping? Already answered. Now baby latches, but when do not get milk, obviously gets cranky. Yes. So 18 days baby will be requiring milk. So you need to work on your supply and the latching issues. Milk production kam ho raha hai. My baby is 3 months. You are repeating the same question. Sarita, my baby is 2 months old and I'm suffering from low milk supplies. From first day, hospital nurses introduced in formula milk before I was awake from cesarean surgery. So he never latched on my breast. But I want to do relactations as still there is 4 to 5 drops. So 2 months baby, still having 4 to 5 drops. Definitely, Sarita, you need to work on this. You can try by yourself or you can reach out to the experts for a customized solution for you. It's your choice. Priya, ma'am, my baby is 220 days old and isn't taking the breast nipple in her mouth. She doesn't open her mouth and taking the formula from the bottle. I am pumping the milk 3-4 times in a day and getting 30 to 40 ml in one time. Already, see, if you are pumping milk only 3 to 4 times and your baby is taking around 6 to 8 drops, 6 to 8 times, then obviously your demand is less than what the baby requires. So first you need to work on your demand and accordingly it will work on your supply. It's already 1.5 hours. So let's stop this session. Whatever questions are left, we'll take them on next Friday and we'll connect on next Friday. And today was my fast also. So right now I don't feel like talking more. I feel a lot of this already answering the questions from last 1.5 hours. So we started at 7 p.m. and it is already 8:18 now. So we'll connect again on next Friday. So you can take your questions and copy them, and you can put them on the chat box next Friday. Come on time so that I can answer your questions at a at earlier way. So that's all for today. Take care, everyone. Good night.